Hello and welcome back to Educate Me MD. Today we'll continue on the journey of a newborn who's now a couple of days old. We've previously discussed the delivery, the newborn exam, as well as specific vital signs and the initial treatments given. Today we're going to focus on head size, bilirubin, and briefly touch on the newborn screen test. I'll go into uncommon depth on common topics to explain the ordinary in a new way, so please join us. I'm Dr. Sarah Soltz, a general pediatrician. I'm very excited to be back with you. I wanted to start by bringing in an update of the baby girl that we've been following. Let's pretend she's now 2 days old and I'm visiting her room with her parents and the nurse present. She's continued to feed well, and Mom got some instruction from a lactation consultant yesterday and feels that she's latching much better. Her weight only dropped a couple more ounces to 6 pounds 10 ounces, so I'm pleased that she seems to be getting enough to eat. Her head size today was 35 centimeters. Yesterday it was 34, and at birth it was 33 centimeters. She did have significant molding after birth, which is when the head has taken on a longer or more oblong appearance, and it is a normal occurrence after a vaginal birth and will resume a more round shape in a few days. As you can see from the picture, this head shape might have caused the earlier measurement to be lower and the number to increase as the swelling and shape become rounder. The head should always be measured from the forehead straight around the back of the head. So our little girl's bilirubin was 9 at 48 hours, which is low risk, and her first newborn screen has been taken and sent off to the state. With this information, you can probably figure out what we're going to talk about today, starting with head size. This may not seem like a big deal, but if you think about it, the head holds the brain, which is one of the most important organs in the body. So if there's an issue inside the baby's head, a rapid change in head size might be our first indicator. Sutures are the gaps that are between the bones of the head. On the very top of the head, 4 sutures come together to make the anterior fontanelle, which is commonly called the soft spot. This is a very sensitive area of the body and should be touched very gently, and any injury always protected from injury. The bones in a newborn skull actually are quite mobile and can move around some and either stretch out or come together, especially during labor. As they get pushed together, they could overlap in certain places, which may create ridges that can be felt on the skull. This is a normal phenomenon and usually resolves in a few days to first few weeks in longest case. Sometimes there can be a lot of swelling or molding, like in our baby girl above, especially when the top or back of the head gets pushed more during a long labor. Unfortunately, sometimes the action of labor or birth can cause bleeding either under the skin outside of the skull or inside the brain. The use of a vacuum or forceps to help delivery can increase the risk of bleeding as well. So if the bleeding is outside the skull, then that's often seen as a boggy or bruised or sometimes more full or firm area, often on the presenting part or on the back of the head, and it can be monitored without treatment unless it's excessively big or we're worried that there's ongoing bleeding. If there's a fracture of the skull or a bleed inside the brain, then we likely won't know unless we do see a sudden increase in the head size or a change in the baby's behavior or movements. The baby may be really fussy due to pain, or we may see different pupil reactions, a seizure, or poor feeding. This is luckily not too common, but still important to screen for, and one of the things that we are tracking when we check baby's head size every day. Our baby girl has not had any of these symptoms, and the skin around her head appears normal color and a little soft at the top still, but significantly improved from birth. So rarely a baby may have an issue with making too much cerebral spinal fluid, or CSF. The CSF is normally made in the center of the brain and distributed all around the brain and spinal cord. So if there's too much of it or a blockage somewhere within the brain, preventing it from draining, then this can cause a disorder called hydrocephalus. So literally hydro for too much water and cephalus, meaning on the brain. And this is a serious emergency as well. This can also be picked up by a change in head size or a bulging fontanelle, or pushes up, or some of the symptoms that were mentioned above. If this happens, an ultrasound of the head can be done to diagnose the issue, and usually neurology or neurosurgery is called to determine the next steps. I'm always amazed that we can use ultrasound in this area of the body. Since there is no bone in the anterior fontanelle, most of the times it's large enough that an ultrasound tech can put a probe on the spot and get images of the brain with no radiation, and it doesn't require sedation like is sometimes required with MRI, which is the other way that we get good images of the brain. So head size can be measured in inches, but usually done in centimeters. It's that metric system again, with a soft plastic or paper measuring tape wrapped around the largest circumference from front to back, and obviously tracked each day to look for changes. It's usually concerning if it changes more than about 1 centimeter each day. Our girl at the beginning was right at this limit from 35 to 34, and then she had started at 33, but since her head shape has changed from its original, which kind of accounts for some of that increase. Her fontanelle is still nice and soft. The skin looks good. She has lost some weight, which sometimes can lead to a decrease, but in her case, not so much that I think that that's making a difference. And then, so at this point, did not feel that any imaging or further workup was necessary for her. If I had, then the next step would be determined by the rest of the exam. Any abnormalities in her vitals, and any other symptoms she might be having. She might need imaging, like the ultrasound or MRI, to look for anemia, or a spinal tap to look for increased pressure. A spinal tap is done with a needle in the lower part of the spine in between the vertebrae after the spinal column has ended, and can measure pressure throughout the whole system. I know that sounds like a scary procedure, but it's usually important just to think about doing things in a stepwise manner to make sure we're not overdoing treatments, but also not missing anything. That's why I like to be meticulous about my numbers and tracking things each day. Head size can be an easy test that gives big information when measured and followed properly. Okay, moving on to our second topic of the day, which is hyperbilirubinemia. It's a big word, so let's break it down. Hyper is when there's too much of something. Bilirubin is a compound that comes from the breakdown of red blood cells, and emia means in the blood. So hyperbilirubinemia or hyperbilirubinemia. When the bilirubin level is high, the first symptom is that the skin or eyes look yellow, which we call jaundice. Jaundice often shows up first in the face. These are kind of old-fashioned ways of guessing, but we usually say maybe a level of about 5 milligrams per deciliter, and then in the chest or down to the belly when we're about a level of 10, and then all the way to the extremities when we get 15 to 20. We don't really use those ranges to associate it with that anymore, but just to show that as the number goes up, the jaundice extends further around on the body. So jaundice is not always easy to be seen. And so in the past, we would wait until we see jaundice to decide to test a baby's bilirubin. But since that's not reliable for the past 15 or 20 years, the standard has been to check every baby that's born at least once after 24 hours to make sure their bilirubin level is in a safe range. The most accurate way to test is with a blood test. And most labs only need a very small amount of blood, less than about 1 milliliter. And it can be collected from a heel stick, but there are also machines that many hospitals have that can test a bilirubin level through the skin, kind of like a thermometer. And it's called a transcutaneous bilirubinometer, or TCB for short, and it can be done on the head or on the chest. It depends on which meter and how it's calibrated, and usually tells you where you're supposed to use it. They are not as reliable as the blood test, and they can be affected by baby's skin color or underlying skin tone, but it can be used as a screening test, and if it's abnormal, then the blood test is done. So this saves a lot of unnecessary blood tests if we get a normal level with the TCB. So hyperbilirubinemia itself can be a complex topic because some elevated bilirubin level is thought to be normal or even helpful, but too much can definitely be harmful to the brain and potentially other organs in the body. This disease, when it causes brain damage, is called kernicterus. So one way I often explain it even though it's not 100% accurate, is that all babies are kind of born with more blood than they need. And as that extra blood breaks down, then bilirubin is released from those red blood cells and processed by the liver and then removed from the body in urine and mostly in the stool. Therefore, these are the 3 points at which we can get too much in our body. 1, if there's too much blood breaking down, because there's a bleed somewhere like the head issues mentioned above, or if there's an antibody from mom's blood that crossed to the baby and is attacking the baby's blood cells. So number 2, if the liver is not working well, either due to prematurity or other liver disease. And 3, if the baby is not voiding or stooling well, then the bilirubin will accumulate. We do not usually test a level before 24 hours old because it takes time for some bilirubin to accumulate unless there's visible jaundice or other concerns younger than that. And the level can continue to go up for several days or even a week or two. And there's several factors that may increase the risk for hyperbilirubinemia. So the first factor is prematurity. This is thought to be due to an increase in bilirubin because the liver is immature and can't process the bilirubin well. Number 2 is mom's blood type. So like I mentioned above, if it's different than the baby's, sometimes antibodies from mom's body can cross over. And this can lead to anemia and significant hyperbilirubinemia. So if a mom is O or negative, then the baby's blood type is checked to see if this is happening. And all moms who have a negative, the positive and negative part of their blood type, should receive a medicine called Rogam to help prevent this interaction. The third reason why a baby may be more likely to have a high bilirubin level is if they're breastfed. This may seem odd, but in the short term, the dehydration from not taking in much liquid before mom's milk comes in can lead to less voiding and stooling, so the baby does not get rid of the bilirubin as fast. In the longer term of 2 to 4 weeks, mom's milk has a unique enzyme that may slow the breakdown of bilirubin in the liver and cause a baby to have persistent jaundice that's usually not at the level that needs any intervention. Once a baby has a bilirubin test done, the number is charted with their age and compared to a standard, often using a website called bilitool.org, and to determine if they need any further testing or treatment. If the level is high for their age, so higher bilirubin levels are allowed as the baby gets older, but it can still get too high. So the first treatment is often that they're started on a special kind of light therapy that we call phototherapy. And this is when they are exposed to a fluorescent light in the blue spectrum, since it doesn't get as hot as the red spectrum. And it's used either as a special kind of blanket that can wrap around the baby or exposed above with bright light or bank of lights. And it helps to break down the bilirubin through the skin and therefore bypass some of the work of the liver. If the phototherapy is not enough or levels continue to climb, then there is a treatment called exchange transfusion. But it's quite rare to get to this point because we're doing a good job at screening and catching it early. So I won't go into the details of it, but just know that there are other treatments for severe cases. So in summary, hyperbilirubinemia is when the bilirubin level gets too high. One of the early symptoms is jaundice, but the late symptom is brain damage. So we always want to catch babies before they get to that point. But as we've learned more about this disease process, we actually tolerate a little bit higher levels of bilirubin before we get to treatment levels because we found the level has to be pretty high to cause those dangerous symptoms for majority of babies. The last thing I wanted to mention today is the newborn screen. This is an important test that's mandatory in all 50 states in the United States with a short list of mandatory diseases like thyroid disease, sickle cell, and PKU, which is short for phenylketonuria. This was actually the first one ever on the screening test, although the complete list of diseases tested may vary from state to state. A lot of these diseases are metabolic or endocrine, and so they're rare and have really unusual names, but it's so helpful when we can catch them early. And one of the most recent additions to this list was spinal muscular atrophy, which is a very difficult disease if you know anybody who's had it, and so being able to pick that up early can make a really big difference for these patients. And there are even more diseases that are going to be added in 2025, which is very exciting. So the test for the newborn screen is usually a heel stick with drops of blood dabbed onto a special paper that's mailed to the state lab or to a private lab, depending on the hospital. And it's usually done at 24 hours after birth, and some states do a second test. In Texas, that second test is done at 7 to 14 days because some of the diseases don't begin to show enough of the metabolite that they're testing for until feeding is well established, and that's not always the case at 24 hours old. So a disease makes a good option for this kind of testing if it meets a few criteria. First, it has minimal symptoms at birth, so there's time to complete the testing before they get really sick. Second, it has a test that we can, or a metabolite or a chemical that we can test for that can pick up the illness before there are symptoms, such as an elevated TSH for thyroid disease. Number 3, it has to be relatively cheap to perform the test. So in Texas, we screen for over 50 diseases with really a very little amount of blood. And you can see the full list through a link that I put in the show notes if you're interested. The cost of the test is covered by most insurances, and the cash price is around $75 if you don't have insurance. It's an amazing test to be able to look for many things with such a small amount of blood. I'm a big fan. As I mentioned earlier, our baby girl we're following had her first newborn screen already. Her bilirubin level was 9 at 48 hours, which put her in the low risk range. So even though she is noted to have some jaundice in her eyes, face, and chest, we don't need to do any more testing or treatment unless things change. She doesn't start to gain weight in the next couple of days. And she's given clearance to proceed with discharge planning today. So in summary, we have talked about the importance of tracking head size after birth, monitoring bilirubin levels closely, and the newborn screen. Next week, I plan to talk about discharge requirements with the hearing test and the car seat check before ending this initial series. So remember to check back in for that episode. Please, if you find these episodes helpful, hit the like button, subscribe, and even leave a comment so I can learn who is watching and hopefully enjoying my videos. Thank you for listening to Educate Me MD. I hope you have learned something today or understood it in a new way. Have a wonderful day. Disclaimer, the information contained in this podcast is strictly informational, and even though I am a doctor, I am not your doctor, and you should always consult with your own healthcare team before making significant changes to your care.